The treatment of carpal tunnel syndrome usually begins with non-operative measures. Common non-operative treatments include anti-inflammatory medications like ibuprofen and naproxen. In addition, we'll use a nighttime splint to hold the wrist in a neutral position, which takes the pressure off the nerve. These simple measures will often afford an improvement for patients in up to 60 or 70% of our patients. We typically then give consideration to surgery. And I like to operate on people before their symptoms are continuous, but if they affect them on a daily basis or interfere with essential activities, then it's time for surgery. If somebody needs surgery for carpal tunnel syndrome, on the day of surgery, I'll come and see them beforehand. We'll mark their wrists, and then they go to the operating room. In the operating room, we use intravenous sedation, which makes the whole experience very pleasant for them. We use a lot of local anesthetics so that when the sedation wears off, they're very comfortable, and that also provides pain control during the surgery itself. The operation only lasts about 10 or 15 minutes, and then we're all through. After surgery, they'll have a soft dressing on their hand, there's no splint used, and they can take that dressing off just a few days later. They can shower at that point in time and apply antibiotic ointment and a Band-Aid to their incisions. I usually have them return to see me about 2 weeks after surgery when we take their sutures out. They'll also see the hand therapist at that time, which usually amounts to just one post-operative visit. They'll get some home exercises to do at that time, as well as some stretching and so forth. Finally, they'll come back to see me about 6 weeks after surgery, and then again another 6 weeks after that. So altogether, I see them about 3 months after surgery. Most patients can expect after surgery that we're going to restrict their activities with the hand in terms of strength activities for about 3 weeks. After that, we allow them to increase the use of their hand as they tolerate, anticipating that most patients will be able to do everything they want with their hand at around 8 weeks after surgery. Some patients have a very heavy manual job, and those patients may require an additional 6 to 8 weeks until they're doing all of their normal activities. Like all operations, there are risks to having carpal tunnel surgery performed. These can include things like pain in the palm, very rare instances of nerve injury, and chronic pain in the hand. Of course, we try and avoid these as much as possible, and although carpal tunnel syndrome is one of the most common operations that I do, every patient's carpal tunnel surgery is the most important one for them. So we take our time and make sure that we've done a thorough and well done job for the patient, because we realize that every time we do this very common operation, it's extremely important. Oftentimes patients don't know if they have carpal tunnel syndrome. They may have pain in their hand, they may have a vague sensation of swelling in their palm or fingers. They may have fingers that are going numb. And the right thing to do is to come in and have a visit with us. It's very easy just to call, make an appointment, come in, we'll evaluate the patient, and just help them understand what it is that they have and what are the right treatment options based upon what the disease is that they have and how severe it is.